coming up.
I was ultimately diagnosed with two different types of jaw conditions, idiopathic condylar resorption,
It's
which just means,
basically where they take the upper jawbone, the maxilla, and then the mandible, the lower jawbone, and move them all forward surgically. So it's
okay,
basically,
so I have these pictures. These are before braces, and I feel like it's important to show these because, well, one, you can see the cant in my jaw. It just shows like kind of the crazy wonky shape it had. But also you can see I still kind of had a jawline in these pictures. So I had a big forward advancement in the maxilla, and then with the chin advancement and with the prosthetic jaw joints, he really positioned my jaw much more far forward. And, if you're going to go for something this big, you should definitely pick a great surgeon and have really high expectations, make your needs known, all of that.
yes, this is Kimi Nishimoto. And today we have a guest, Shannon, who is a patient who had MMA jaw surgery. And so she's going to tell us all about her experience, the good, the bad, the ugly, the hard, and obviously show off her amazing new face. So, Shannon, tell us a little bit about you and your history and just kind of like what led you down this path.
Yeah, so I had jaw issues starting back in high school when I had orthodontic treatment. Um, and I know now that I think a little my orthodontic treatment was what a lot of people call camouflage orthodontics in the field. Um, my it's a term for, I guess, situating the teeth in a way to camouflage structural challenges. Is that right, Kimmy?
Yeah, it's
Yeah.
like there's discrepancy between the jaw bones, but you straighten the teeth so it looks good, but it may not
Hmm.
be functional.
Yeah, and I think it was a common result of camouflage orthodontics is really, really stressed out jaw joints. Um, I was ultimately diagnosed with two different types of jaw conditions, idiopathic condylar resorption, which just means that the bones in my condyles resorbed. Uh, Idiopathic means there's no known cause. The more and more research that they do, the more they think it's associated with endocrine disorders or endocrine disruption, because they find it a lot in females, and it happens. It exasperates itself over periods of time where there's big hormonal shifts. So for me, so I had that. I had idiopathic condylar resorption, and I also had this other funny mess going on with one side of my jaw growing a lot larger and continuing to grow through adulthood. So the result was this really, really wonky, canted jaw. Um, and my orthodontics temporarily fixed that, but stressed my jaw joints out to no end. I had pretty debilitating TMJ. I can't remember a time where I didn't have pretty constant headaches, neck tension, um, lack of function and ability to chew and eat and all that. And all those things got progressively worse for me after two pregnancies that I had in my early 20s, which is really when I went and sought out help when my cant had or things had regressed, or the bones had resorbed, or whatever combination of things was going on. It had done so enough that I was only able to really chew on the knife edge of one side of my mouth. And I was starting to really struggle with my appearance, sort of progressively changing or rapidly changing. Um, and yeah, I started to develop sleep apnea and let's see, yeah, sleep apnea. My appearance changed, um, little function with eating, and a lot of pain all the time. So when I let things get really, really bad is when I decided to go seek help. And I started out with a few different things. My first step was an airway dentist, and the scans that he took showed me that my airway was really, really tiny. I think like 2 millimeters or
Two
something.
millimeters, guys. I have a small airway and mine's about a 6.5, 7, and it's tiny. So hers is 2 millimeters, which is less than a coffee straw.
Yeah. Yeah, less than a coffee straw. Yeah, it was really stressful information. I was offered a chance to do some get basically an adult palate expander, a version of an adult palate expander.
Mm,
I kind of had a hunch though. The manufacturer of the device actually contacted me and said, I really don't know if you're actually the right candidate for
mm,
this product. I think that they can work for some people. I would caution anybody with really complicated jaw disorders to get second opinions about expander devices.
mhm.
So I did. I got a second opinion. And I actually consulted with Dr. Zoggy, an ENT with was it the Breath Institute?
The Breathe Institute, yeah.
Breathe Institute, yeah, in Los Angeles. And yeah, he didn't hesitate looking at my scans and my information that I needed to consult with some of the best jaw surgeons in the nation. And that's what I did. I consulted with 2 or 3 and got the really hard news that I likely needed my condyles replaced, which is a procedure called bilateral total joint replacement. And so that was big news and terrifying.
Mm-hmm.
And I also needed to have MMA, which is you're gonna have to tell me what that stands for, Kimmy, but
It's basically where they take the upper jawbone, the maxilla, and then the mandible, the lower jawbone, and move them all forward surgically. So it's basically like you cut the bones, you reposition them, and then you have to heal.
Yeah. Yeah. So I needed a little bit of everything to fix what I had going on. I ended up with a surgeon down in Birmingham, and yep, about a year ago, started that journey. I was in braces for about 16 months leading up to that. It was really crazy seeing the changes, just from, the braces that I had undid all of the camouflage braces. So the change in my appearance was pretty drastic, really sad, really depressing. So, and the same thing with the surgery. It was a year of, it was a long, hard year. So
Mhm.
happy to be 1 year out. I think I'm officially 1 year out.
Yes, and you've done so well because it was really hard for you because with the braces, basically they had to get your teeth into a certain alignment and then move the jaws and fit them together. So it was really hard for you to chew. It was really hard for you to eat food because your teeth didn't fit together. And then
Mhm.
you had the open bite where it was like the front teeth didn't touch. And it's like no wonder why your muscles also were hurting because everything was just mismatched. It's almost like Tupperware lids that don't fit on the container. So when you pop it on one side, it pops off the other. So I remember that you had just a quite a long time leading up to the surgery and then the time after the surgery where eating was just tricky.
Yeah, yeah. Well, for the first, I think my teeth were wired onto a splint for the first 10 weeks or so post surgery. Um, and so I was on a liquid diet for, I honestly, like 3 months, really. I was on
Oof.
a liquid diet. Yeah. Yeah. I'm not really like a big fan of soup anymore, but and yeah, I mean, leading up to it, I was at a point where it was really, really hard to get through food. I will say I really just until last month when I got the braces off, and my teeth have started to kind of settle after braces. And I have that really good bite and that good contact.
Mm.
It's just the more that things progressed in that direction, the less tension I was experiencing, the less pain and just irritation. So the more that my teeth touch, the easier everything else comes, the
Mhm.
better that bite and that contact is. And the more natural that it is and like aligned with my, not having to pull my jaw forward to bite my teeth down, and I'm not having to do
Mhm.
anything crazy like that to get good contact. It's just, I just chew now without thinking. I just chew.
Mhm.
So
And you chew on both sides of the mouth at the same
yeah.
time, the 50-50 chewing.
Yeah.
Um, okay, I want to talk a little bit about your timeline of how you did things. And then I know that you have some photos to show us, which I'm really, really excited about. So can you just tell us about like start to finish, like what the timelines of things were and how long it was in between? Because it was a little bit frustrating because it was also during COVID. So
Hmm.
everything with the medical system was really, really slow. So tell us about like the
It
whole
was super
process.
long. Yeah. Okay. I think that it was probably in 2019 when I started the process. I got my first airway scan. That was when I went to the airway dentist and said, is there anything we can do here?
Hmm.
So that was like really late in 2019. By the time that I visited surgeons in 2020, it was really hard to get like MRI appointments and all those imaging appointments that were necessary to make full diagnoses. There's also with the double joint replacement and jaw surgery in general, it's just one of those tricky ones with insurance. So there was a lot of steps that had to take place for insurance approval. Um, that's like we could do a whole other podcast on that, but we won't. That's just a nightmare. It ended up being a lot out of pocket for me to have this surgery, but I think we did the best we could. But um, so yeah, 2020 was really the year when I got my plan in place. Like maybe late 2020 was the time where I was like, okay, we got to start like raising funds for this or saving money or figuring out, how we can piece this stuff together. And then by early 2021, I had landed on a surgeon that I felt comfortable with. And I want to say I got my braces on maybe early 2021 as well. I think March of 2021. I was connected with an orthodontist through the surgeon who could work closely with the surgeon. I think the good working relationship between the surgeon and the orthodontist is important. So
Hmm.
I was set up with somebody who's like, he's amazing. He knows what he's doing. He has a great relationship with my surgeon. It's 2 hours away, so I drove 2 hours every time. 2 hours there, two
Wow.
hours back for every appointment. But yeah, so that was early 2021, and then I had to wait until my teeth were ready. And I think that's a decision that the orthodontist and the surgeon make together, but they really wanted to see my bite be as balanced as possible before we started surgery. So they wanted to they say surgery moves bone, not teeth. So they want to move the bone before they move, or they want to move the teeth before they move the bone. So they did the best they could to give me like a satisfactory bite. And then I had, when I was ready for that, I got some scans done for the prosthetic joints that they used in my jaw to replace those damaged jaw joints. And that process took a pretty long time. I think from the time we got the scans to the time we got the completed joints, it was 6 months.
Oof.
Yeah. So, they scan you when you're ready for surgery. So it's like you're like all excited. You're like, oh, I finished the braces, like I'm ready for surgery. So they scan you and then you wait. Um, this was during COVID, like Kimmy said. So 6 months was actually on the faster end. I was in contact with a lot of other people having the surgery. A lot of people were waiting 9 to 12 months. So
Oh.
yeah, 6 months. And then once the joints were in hand, we booked the surgery and we got rolling. Yep.
And when was your surgery?
So my first surgery was September 29th. Um, I had a really unfortunate kind of fluke experience where the first surgery, something went wrong. There was a huge complication during the surgery. It was a 14-hour surgery.
Oh.
Yeah, 14 hours. And when I went back for my follow-up 2 weeks later, um, and I learned after the surgery, like my husband had said something about, they kept coming out and saying things weren't going well. They were really upfront and honest about like they couldn't figure out why things weren't fitting together during the surgery, which is why it took so long. I think those surgeries are typically, at the most 10 hours, but closer to 6 to 10. So 14 hours is a pretty long time to be under. I don't think it's custom. So when we got my scans 2 weeks later at the follow-up appointment, they saw that the prosthetic joint actually was dislocated, and they think it was dislocated actually during surgery. That caused all the movements in my Le Fort. So I had my upper jaw rotated, but all of those movements were off by a few millimeters because the joint had been dislocated, which caused sort of like a whole shift in the whole structure. So, honestly, probably hardest news I've ever received in my
I
life.
think I cried for you when you messaged me that you had to do it again. I think I cried for you. I felt so bad that you had to
Yeah.
do it again.
It was like I remember sitting in the chair and they didn't have any tissues around. And so I'm sobbing. I was really upset. They kept giving me gauze to like dry my nose.
Like
But
this is all like webbed.
it's gauze, but like my mouth was like open. And I had this big splint on it and all this wire. And so I was like trying to wipe the snot, and the gauze was getting caught all on this wire. And so they had to come and like, pick the gauze off it. And I just remember feeling like I just don't like this is bottom, this is like bottom for this
Yeah.
experience.
Oh.
And the good thing about being like about hitting worst case scenario is that like you really can only like it can only get better. I think I had a pretty good feeling over those 2 weeks that there was something wrong.
Mhm.
The way that I woke up from that surgery was pretty horrific. I think being under anesthesia for 14 hours is going to
Oh.
be pretty wild for anybody. But those 2 weeks following that surgery, I think your body just knows sometimes. Having a full like dislocated joint, even though I had no feeling in my face, which is
Mhm.
a huge benefit of the surgery, you go totally numb and hopefully it all comes back. But it
Oh.
is really helpful because otherwise, I don't know if we could kind of
Handle the
endure that
pain.
pain.
Yeah.
Yeah. But yeah, I mean, it was wild. So I went back for my second surgery. October 12th was my second surgery. And it was night and day different. I
Mhm.
mean, that one was about a 9-hour surgery, I think. So pretty long to correct everything. And when I woke up, I just felt different. I
Mhm.
knew it was nowhere near the roller coaster that the first one was. I could just kind of immediately feel that like, okay, we can heal now. Like
Mhm.
we can get to heal.
Balance.
Yeah, yeah. And I think like they really amped up the anti-nausea meds for me too, because that first time was really bad.
Yeah. Oh
Yeah.
man, waking up from general anesthesia, it's like, I don't know about you, but I was so cold when I've had it. Like I was just
Oh,
insanely cold and like could not stop throwing up, which I can't imagine a worse time to throw up is when your mouth is wired shut.
Yeah. Yes. Yeah. I don't really remember a lot. I remember waking up and throwing up and hearing like nurses and doctors yelling, stop throwing up.
You're like, I wish I could.
I was like, well, you can help with that, I think. Give me some medication. But yeah, worst feeling ever. The second time, they gave me this cool patch called a scopamine patch, I think is what it's called. And you
Mhm.
wear it like 24 hours leading up to it, and it's supposed to help a ton. And I also think for anyone going to surgery, it is helpful to tell anesthesiologists, like if you are really prone to nausea, they can actually kind of switch up the techniques so that you're less, I don't know, less nauseous, I guess.
Yeah,
I think it worked for me. It definitely helped.
that's cool.
Yeah. And then by that time, I also knew which medications were going to make me feel bad and which ones weren't, because I had already done that 2 week stretch. So I
Hmm.
was able to tell them, like, I'm not taking that shit. You can
Hmm.
take, like, we'll try something else. So yeah, then the real like journey of healing started. That was a long, long road, but you know,
Yeah, and I'm sure it was worse because you had to do it twice and like all that tissue
yeah.
swelling and damage. Okay, I'm so excited. Will you show us pictures?
Sure. Yeah, yeah, yeah.
Okay.
Let's see.
And then also we should mention too that as you were going through this process that you had learned that myofunctional therapy was a really helpful part of
Yes.
that whole process. So we worked together. We didn't meet as often as I normally would. It was like maybe like 4, 5, 6 weeks in between just to kind of help work on the mouth breathing and then like teaching the tongue where it should rest. We worked on some of the swallowing stuff. And then afterwards, we used it to help your nerves kind of come back online, to help some of the facial muscles come back online. So we did kind of a combo of myo and some face yoga and stuff like that.
Yeah, no, absolutely. I think the myo, if I hadn't done the myo before surgery, which some surgeons say there's no point in doing myo before surgery. I completely disagree. The myo before surgery, I think during the recovery process, I experienced, well, I'll show you in the slideshow. I really struggled with lip competency during my recovery. Um, and also, I think like just to support the healing process, like having your tongue in the proper resting position after you've had major surgery in your maxilla, I think it probably helped with avoiding any kind of relapse in that area too.
Mhm.
Um,
Kind of to act like a support to help
mhm.
hold things.
Yeah. Yeah. Okay. Can you see my screen?
Not yet.
Can you see now?
Oh my God. It's hard to believe that this is you.
I know, yeah. So this first picture was actually the picture that I shared with you prior to getting braces. You'd asked for a side profile, and that's
Oh
what I got.
my
You can see that
gosh.
forward head posture is just crazy.
Yeah,
Yeah. Um, my head posture, I think it's pretty good now. I mean, it's not perfect, but I think it's really good.
amazing. Oh
Yeah.
my gosh, I still can't believe. Okay, and then the picture on the right.
The picture on the right is right after I got my braces off, like 2 weeks ago.
Amazing.
So you can see like, I don't know, just like my facial structure is just totally different.
That jawline.
Mhm.
Oh
Yeah, the
my
jawline. Yeah, it's
God.
so nice.
Ah,
It's great. Yeah, and just like
wow.
my neck posture. I've had to, I do work on that. I do a lot of
Yeah.
exercise and strength training. I think there's a common misconception that like if you fix jawline, you're immediately going to have improved posture. I would say that's not true. I think
Mhm.
you develop the potential to have improved posture because you can actually breathe with proper posture, but I think you have to
Mhm.
actually exercise to get there.
Yeah.
I think you actually have to build the strength, it's a full core thing. Having proper posture
Mhm.
requires like full core engagement. So
Absolutely. Oh
Yeah,
my God. Cannot believe that the girl on the left is the girl that I met.
I know, right?
Oh my gosh.
Yeah.
Okay, more, more,
So
more.
this is before braces. And I wanted to show these pictures just because I think it's helpful to see before braces. You can see that huge cant that I have there, but you can also see like I had a pretty defined jawline before braces. I think this was a result of camouflage braces. Um, I just have a much more prominent chin. You can see the outline of my jaw. The thing about this period of time, I had debilitating pain. You can see just this larger, uh, the, these lower cheek areas were just like inflamed, masseter muscles. I had really large masseter muscles.
Mm-hmm.
Um, oh, these are hard to look at.
I'm
So
so
these are
proud of you. Thank you for
braces.
sharing.
Yeah. This was braces. This was the first day of braces. You can see like I still have like my shape, the shape of my face is really different versus 12 months after braces. Do you see that?
Yeah, so the picture on the right is you with braces, but this is not after surgery. This is just
No,
braces only.
this is just braces only. Yeah. So from the first day that I got braces to 12 months, I experienced a lot of facial changes in facial
Mm-hmm.
symmetry. Um, I like lot my confidence totally plummeted just because the more that we shifted my bite to be an ideal bite, the more I had that really deep recession, that jawline
Mm-hmm.
recession.
Mm-hmm.
Um, and the more I struggled with airway stuff too.
Mm-hmm.
So
Mm-hmm.
yeah. Um, I think these pictures probably do a good job of showing that condylar resorption. You can just see this is with braces on, just a loss of mass in the lower part of my face. Okay, so I have these pictures. These are before braces, and I feel like it's important to show these because, well, one, you can see the cant in my jaw. It just shows like kind of the crazy wonky shape it had. But also you can see I still kind of had a jawline in these pictures.
Mm-hmm.
I think this is like before the camouflage braces kind of reversed things and changed like the facial structure again.
We want to introduce this Thought for Tots course, a parent's guide for toddlers ages 2 to 5 for Mini Myo. We have Megan and Kimmy going over nasal hygiene, myofunctional exercises, breathing exercises, tongue tie healing protocols, and then we have Jenny June going over sleep hygiene and Kelsey Baker going over feeding therapy and body work. The course is $297 and the link will be in the description.
When I got braces, like this is the first day I had braces, and then this is like to 12 months of braces, and this is like before surgery. So this is in the 16-month window before surgery. And you can just see that I had a really different face shape in this
Mm-hmm.
picture than I did at 12 months out. Yeah, the more my bite kind of came together, the more recessed my jawline got and asymmetrical my kind of maxilla got. So
Mm-hmm.
my confidence really plummeted right around this time.
Yeah. And is it because, like, to get your bite to line up to get you prepped for surgery, they almost had to pull your lower jaw back?
Yeah, I mean, so gosh, I wish I understood more of the movements and how that all works. Um, I think my early orthodontics really pulled my lower jaw and everything in a way that, yeah, I mean, just kind of camouflaged what I had going on. So
Mm-hmm.
a reversal of camouflage orthodontics will often reveal those structural things again.
Mm-hmm.
So yeah, this kind of recessed jawline, this an increase in that gummy smile that I had, and a much more shifted maxilla.
Mm-hmm.
So I think this is a good picture. This shows kind of that condylar resorption that I had going on. You can just see that loss of volume in my face and my lower face. I didn't have severe idiopathic condylar resorption, but if you look that up, a lot of the images that are pulled up, you'll see severely recessed jaws. Mine, I think, was a mild case, but the symptoms were still pretty bad.
Mhm. And
So
you had an interesting one too, where it was like one side almost was acting like a tumor, where it was like
Mhm.
growing, and then the other side was resorbing. So that was like increasing the crookedness.
Yeah, it was like kind of this push-pull experience. So really uncomfortable and just really hard to, I think, help to give me a bite without
Mhm.
major surgery. And that's really why they went with the total joint replacement, or whereas it's not a super common surgery, but
Mhm.
with idiopathic condylar resorption and it being sometimes connected to hormones, there's always a chance that you could continue resorbing. So to prevent relapse and to get a really stable result for cases like mine and other cases of severe condylar resorption, the protocol is joint replacement.
Mhm.
Yeah. So this is immediately after my first surgery. Um, like I said, 14-hour surgery, major complications. I woke up just pretty beaten up.
Yeah.
It's pretty wild.
It's hard to
Um,
believe that that's you.
I know. This one's actually one of the funnier ones. I have some photos where I look like an actual corpse just because of
Oh,
the effects of
poor,
the anesthesia coming off. But
poor baby.
this one I remember I snapped a picture to like one of my best friends. Just, it was the first kind of thing I did when I was coherent, was like, whoa, I look crazy. So here's 2 weeks after surgery when number one, you can see that swelling. It really
Mhm.
peaks around 2 weeks. So this is when we discovered I had a joint dislocation on the scans. You can also, I also was not happy with the I didn't feel like my chin had been moved forward enough. I wasn't happy
Mhm.
with that angle. It's always hard to tell with swelling because
Mhm.
um, you know, it's really hard to tell, but you can see I had absolutely no ability to close my lips at all. A lot of that's because you have this giant splint in there, just keeps things open, but also I just had I had little feeling and function right there. So this is immediately after surgery number two, 2 weeks later. I think you can kind of immediately see the difference in that profile right there.
Yeah.
Yeah, huge difference in the profile. And if anyone's curious, like this is I mean, I know that's just so gory, but that's where they do the incisions.
It's really not bad.
Yeah. So some surgeons do the incision where they actually do it here and here. Mine preferred to hide the incisions, so he did a flap, which means he goes
Amazing.
behind the ear, and so you can see all in that front of the ear here, all the way to the back is where they open you up. Um, yeah, so you can see it here. He actually did a phenomenal job. I don't think anything is noticeable anymore.
Amazing. Amazing. That's
So,
amazing that they can get in there and cut and reposition bones from that tiny little space.
well, they do that for the joint. So they do this whole section for the joint, but then for the jaw cell, they flip you open.
Okay,
That's
and
all
that's
from
where
the
they came
inside
in.
of the mouth. Yeah. Yeah, that's all from the inside of the mouth. So this is at 2 months. You can see 2 months out, I'm still really, really swollen. I had just had my splint removed. I still have a lot of this bruising and the lip incompetence you can see in this picture. I was pretty much had like a gaped open mouth for probably 6 months. It just kind of hung open like that.
Yeah, and you had some numbness too, and that made it hard as well.
Yes. Yeah. So 4 to 6 months, that lip incompetence is getting better, but not great. Still really struggling with naturally holding it. Had still have to work pretty hard. Definitely not as hard But this was around the time where I think I started feeling comfortable to use a Myomunchie to help with that lip incompetence. I had to do a lot of stretching of that scar tissue in that upper from that Lefort procedure. And a lot of the other exercises that we were working on, I think I was able to start doing a lot more of that around this period. Yeah. Still really swollen.
But it's like you can start to see the hope, and it's like the jaw's coming back online, the swelling's getting so much better.
Yeah, I think 5 months is a huge turning point for a lot of people who've had jaw surgery. It certainly was for me. 5 months was the point where, I started to chew more things that I would have, avoided earlier on. 3 months is around the time you can actually start chewing, but 5 months was when I felt really comfortable, chewing into like biting into a burger or something.
Oh, it gave me so much joy when you started to be able to eat food and you were like able to cook and like, I can eat this like actual food again. Like that was so happy to see.
Oh yeah. And now like I can eat anything. I eat steak all the time.
Oh
like,
my God. That's
anything.
So awesome.
Yeah. No issues with anything. So around the 6 to 9 month mark, I still was struggling with that lip incompetence. You can see that swelling has gone down a lot. The scars were still pretty pink. And then I have 9 to 12 months, which is about right around now. You can see, I think at this point, the swelling is pretty much gone. I really thought around 6 months that I was not swollen anymore. But if you look at the difference between 6 months and 12 months, even the difference between 9 and 12, I think, has been crazy. I was really insecure about the chin for a while because it was a huge sort of chin advancement, but the swelling has gone down enough that I'm like fully comfortable with the chin. The chin.
Oh, I love your chin. I think the chin advancement is so cute. And your jawline is symmetrical now. And you have this like amazing, like movie star looking jawline now.
Thank you. It's really nice. I was like really disappointed that we never got my maxilla fully centered. But as soon as I got the braces off, I just decided like, this is what it is. I'm like, I didn't necessarily go through the whole process for aesthetics. That is a part of it though. It's definitely a part of it. I think when you have such a drastic change to your appearance, it's super emotional. So part of the reason for the surgery was definitely aesthetics, but functionally speaking, at this point, I'm 12 months out. I can eat anything. I sleep really well. I have no pain, like none, no pain whatsoever. I'm able to really work on that posture. I've always been active, but my like strength and like ability, kind of for cardiovascular stuff has improved. I mean, I remember the moment that I woke up from that surgery. The first thing I said to the surgeon was like, I can breathe.
Oh,
I can breathe.
Oh my gosh. Do you have any airway scans?
No, I don't have those.
Oh, okay. No problem. No problem.
Because, they tried to send them to me, but they only had the ones that measured the airway volume. They were getting all on my case about like, well, they wanted to make sure it was the same angle that they were looking at so that was like actually accurate results or whatever. So they were like, next time that you're in the office, we'll like actually measure it. So I don't have that.
That's okay. But what did you see when you saw them? Because I know that like they repositioned your upper and lower jaw bones, basically pulling it forward. So it's almost like it stretched your airway and it really increased your volume a ton. Can you talk a little bit about that?
Yeah, so I had a big forward advancement in the maxilla. And then with the chin advancement, and the with the prosthetic jaw joints, he really positioned my jaw much more far forward. The first thing I really noticed was definitely increased upper airway volume. Like I said, when I woke up from the surgery, I just was like so confused with all this oxygen like coming in,
Mhm.
which is crazy because I was really swollen, but I noticed it right away, which was awesome. I don't know if my scans, it actually looks like my lower airway is about the same, maybe a little bit bigger. So, I think that's really a matter of like the angles that the surgeon uses, when they with jaw surgery and MMA in particular, they talk about clockwise rotation. So if you imagine like from the side, you have like a clock on your face, the rotation is like this way. I don't know what my movements were. Some people know that, like they know that their surgeon will say like your movements were certain degrees clockwise or something.
Mhm.
They have to, I think it's really delicate with all of that because they have to line up those rotations with aesthetics.
Mhm.
If they bring you to and not just aesthetics, but your existing bone mass.
Mhm.
I know that I was originally a candidate for a sliding, what's it called when they advance the lower jaw? They make cuts in the lower jaw and they slide
Oh,
it forward.
yes, yes. Mhm.
They ended up not doing that just because I have like really tiny jaw bones.
Mhm.
So they have to make a lot of really hard decisions when it comes to such major changes in your facial bone structure.
Mhm.
Um, I would have liked to see more increase in that lower jaw or in that lower airway. I would have loved to see more of that. Ultimately, I don't notice it. I'm not
Mhm.
waking up out of breath.
Mhm.
I'm
Which is
not.
a gift, right? You're like,
It
I'll take
is.
it. Yeah, I'll take it.
Yeah, I think it's when you do something this major, I think it's good to like have high expectations. If you're going to go for something this big, you should definitely pick like, a great surgeon and have really high expectations, make your needs known, all of that. But also have the wisdom to know that it's you can't have it all.
Mhm. Yeah.
And there's you know good enough is good enough sometimes. So
Mhm.
especially after having two surgeries, I think I've sort of set aside the concerns about it. Because I do feel like my function and all of my symptoms and all of that, they've improved enough for me to feel like I can kind of move forward in my life. And
Mhm.
yeah.
Which
So
is, it makes me so happy. I always am so happy that you're doing so good. And, you do it for the health, but you had such a beautiful change in your face. It just gives me so much joy to see you so
yeah.
happy and feel confident. Because I know for a while you're really like funny and you're like able to like laugh at things like the picture you posted with like right after surgery. Like you're so funny to share that. But like it
Yeah.
makes me happy to see like you feeling so confident and you look beautiful.
Thank you.
I
Thanks.
I want to ask you one more thing before we wrap here. So I think a lot of times like in in the orthodontic field or people that need jaw surgery, it's just like braces, jaw surgery, and then there's not always a ton of like extra help on top of it. You're really on it. So like you made sure you did your myo, but you also did additional things that really helped you. Like I remember that you told me that acupuncture helped you to get a lot of the feeling and proprioception back. So can you
Hmm.
talk a little bit about when you incorporated the acupuncture and then when did you incorporate like the lymphatic drainage massages that helped with the swelling?
Yeah, no, that's great. I think I was cleared for my first lymphatic massage at 12 weeks post-surgery. So around 3 months, I was allowed to get the lymphatic massage. That really, if you have a great practitioner skilled in lymphatic massage, it can be such a game changer if you are going through a surgery where you're holding that much swelling. For me in particular, and most people who have like major surgery to the jaw, your lymphatic system is like so much of it is right here. So it's really helpful to have something to come and help move things along and wake that system up. Acupuncture, I was really struggling with my facial numbness. I was really fortunate to not have any paralysis. A lot of people will get what looks like Bell's palsy symptoms, or one eyebrow is like crazy droopy. I didn't have anything like that, but I did have so much numbness around my mouth. I was kind of constantly drooling for months, really struggling with lip dryness because I couldn't bring my lips together. Talking felt really funny. I'm finally at a point where I think I'm talking a little bit more naturally. So I started the acupuncture, I think probably around 4 or 5 months post-surgery, I think. And that was great for like the therapeutic and relaxing benefits, but I also started to see like an immediate change in sensation in my face from that. I got it brought feeling back a lot sooner, and that really helped with me being able to feel and understand my face and what I was doing. Like Kimmy said, that proprioception is really important. It's really hard to do exercises and move something if you can't feel it moving.
Mm-hmm.
So unless you're looking in a mirror, but that was really helpful. I still do have I don't have full sensation in my upper maxilla. I have it in my face and most other parts of my mouth, but that upper maxilla is pretty numb. And they expect that if 12 months out it's pretty numb, it's probably permanently numb. So there's different things you can try for that, and I'll probably keep trying for it, just because it's always good to get that back. But I'm at a pretty good place with it. So I did that. And then, yeah, I mean, the more and more I felt comfortable with the myofunctional therapy, it's easy to get really, really frustrated and stressed out when you have such a long recovery period.
Mm-hmm.
For me, the lip incompetence drove me crazy. I mean, I really struggled with the appearance of it, like having your mouth kind of hang open all the time. I was really struggling with that. And I really struggled with, food falling out of my mouth while I was eating because of it. Kissing, like it really messed with my intimacy because I was really struggling to like have like just a good juicy kiss, or to kiss my kids on the forehead. So the lip function was really hard for me. And the more I felt comfortable incorporating those exercises, and the more I just really like, it's patience, right? Because I could push the exercises, but there were times where, my body just wasn't ready to go there.
Mm-hmm.
When I kept doing the exercises, there was a period of time where I kind of just had to stop and just let it.
Let yourself heal.
Yeah, just ride it out, and trust the process. So, probably around 6 to 9 months is when I actually felt like, oh, I think this will kind of come back together. And the other thing I'll say with the lip incompetence is, after surgery, I didn't have an ideal bite. It took a full year after surgery of braces to get my teeth in a good bite. I am one of those people, and I think most people are like this, where if your teeth are not in a good bite pattern, if you don't have good contact, it's going to be hard to get those lips closed. I had, just a really uncomfortable bite situation. So the more that the bite came together, the more natural my lips were sitting. So, Yeah, I mean, probably I think I really hit stride around 6 months. Like I was able to incorporate more things that made me feel good. I started exercising again. Um, yeah.
Yeah. Thank you for sharing. And thank you for being so honest about it. Cause like I think that helps people. Cause sometimes you think about the surgery as like, well, that's the fix. And then we don't always think about the after part, which is not an easy recovery and it's a little bit longer than you would expect.
Yeah. It's really like it's mostly mental. You saw those pictures. I didn't feel confident with how I looked until maybe 9 months. And then even so, just in the last few weeks, getting the braces off. That's a long time to wait. Like 12 months is a long time to wait to see if you are actually okay with how your face looks after major facial change. So I think dysmorphia, dysmorphia. I think that body dysmorphia is a wild ride. And most people I know who've gone through that surgery, they have that same experience of like just really struggling with what they see in the mirror for a really long time. And I think that's probably lifelong, right? I look in the mirror sometimes and I see this big old jaw and I know that it doesn't look like that to other people, but if that's new for me, having a new jawline. So, sometimes I struggle with like, oh, it looks so masculine or something. And I know that other people don't see that, but it's like, your face kind of drastically changing. It just takes a lot of kind of compassion and
gentleness, acceptance of yourself. Yeah. I'm sure that would be a wild ride. And plus it's so swollen for a long time that you're like, wait, where is it?
Yeah. You just look pretty crazy for a little while. And it's funny because people don't say anything, right? Like they know that you look crazy swollen, but like people aren't going to ask you like what's going on. So you kind of get in your head a little bit of like, do people think I actually look like this? Like what?
I have a question for you, Shan.
Yeah.
Would you like recommend your surgeon? Like, would you like want to like give him a shout out?
Yeah, totally. Yeah, so things didn't necessarily go well with my first surgery. The way that he handled that, um, honestly, like was a kind of a healing experience for me and my whole medical journey. Um, you know, he took ownership and responsibility and he also has a stellar reputation. So I think it was one of those situations where he could have kind of easily blamed somebody else, like a resident in the room or, but he was compassionate. He wasn't robotic about it. It was just a tragic experience for me. And I felt supported in that moment. I was alone for that appointment where I found out we had to redo it. And I, felt really supported by him. And then he really did me right. He really, he fought insurance to make sure I didn't have to pay for a revision surgery. He checked in often. He really listened to what I wanted out of the experience. He even threw in some chin lipo for that second surgery. So, so his name is Dr. Patrick Lewis at UAB Medical Center. It's a university medical system, but I received stellar care, even if the facilities are older or it's UAB, not UAV.
What is it?
UAB, University of Birmingham.
Oh, thank you. Yeah. And is it Lewis, Lewis or
Louis? Yeah. But yeah, I mean, everybody was just I think I'm an easy person to work with. I was a great patient. I will say, they have a lot of responsibility for patient care. But everybody has an individual responsibility to be, courteous and respectful and understanding. And I feel like we had a really good thing going and I had a lot of trust with my medical team. as hard as it was, I wouldn't have wanted to be with anybody else. So
Yeah, I'm really glad that you were able to find them, because I don't want to go into it too much, but that one surgeon you had was and
yeah.
wasn't willing to do insurance and was like, mortgage your house. And I have never been more angry at any medical
Yeah.
provider. And oh my God.
A lot of jaw surgeons, especially top jaw surgeons, they don't work with insurance, which I understand why they don't work with insurance. I'm not a huge fan of insurance companies. Um, but I'd like to think that surgeries like these, and this is probably just a larger critique of our medical system in general, in the United States, but I think surgeries like these and conditions like these shouldn't be for privileged people. I think they should be for people who need them, end of story. Like if you have a major medical condition that's affecting your function and your pain on a daily basis, I don't think that to get quality care, you should mortgage your house or, I don't think you should have to do that. But that's the United States for you. So,
I know. Sure is.
yeah.
In the future, I would like to, as medical tourism becomes more popular, I would love that to be an option, is like, oh, you could go to Turkey, or you could go to other
Yeah.
common ones is like Korea. It's a really common one for medical tourism.
Interesting. Actually, so it's actually really common for people to come here for the surgery because it's not offered other places, really.
Really?
A lot of people from the UK come to the United States and pay top dollar to see our top jaw surgeons.
Wow, that's good to know.
Yeah.
And there's a support group online for people going through MMA and jaw surgery. How can people find that support group?
Yeah, there's a few different ones. If you suspect you have idiopathic condylar resorption, you can just search idiopathic condylar resorption, and there's a Facebook group that you can join. If you think you have more conventional jaw disorders or disorders of the jaw that might just require Lafort or MMA surgery, so none of the prosthetic joint procedure, there's a group called TMJ Surgical Group, and you can join that one. And it's a great community of people who you know can answer questions about their experience. I would say, if you find some of that stuff interesting in there, definitely seek out the advice of a qualified provider. There's a lot of great things that you can find on a Facebook group. There's also a lot of things a Facebook group can't do. So,
Yeah. Awesome. Thank you so, so much for sharing, and for being so open and honest and raw, and for sharing your pictures. I think that a lot of people will really find them interesting. You can find me at Mouth Muscle Memory. Shannon, you're amazing. Thank you so much. And thank you for your time today.
Yeah, of course. Thank you for having me.
Thank you. Bye.
Yeah.